No more testing at the border, no more quarantines, no more ArriveCan app, unless you want it. No masks on planes and trains as of October 1st. All the border mandates are suddenly dropped. It's really a remarkable moment when you think about it. March 11th, 2020, the WHO declares a global pandemic. April 20th of that year, mask mandates on planes come to effect here. And then we go to today, September 26th, when the government ends the restrictions. In that period of time, 44,992 Canadians died of COVID, according to Health Canada. We don't mention that enough. There were a total of over 4 million COVID-19 cases. And by the way, it's still going on. There were 17,325 cases counted, get this, between September 11th to September 17th. So why end it all now? What's the data point on this? Let's find out. Joining me now is the Intergovernmental Affairs Minister, Dominic LeBlanc. Good to have you. I know we've got a special segment coming on. Look, your government always says you're, evidence-based policy. Many people thought you could have ended these mandates a lot earlier, but now they're ending on October the 1st. What is the data that says, okay, no more masks on planes and trains, no more? What was the threshold met? Do we know it?
Well, sure, and Dr. New talked about that in the news conference I attended earlier this morning, Evan. The community transmission, the borders are no longer seen as a significant source of the importation of the virus. The virus is circulating in communities across the country. Various provincial health authorities have removed various mandates, masking mandates, and so on within their jurisdiction. We talked to the Public Health Agency of Canada, to doctors, to scientists, and we thought at the renewal of these orders in council, as you know, the cabinet orders which put into effect these measures are expiring on September 30th, and we announced today that we simply will not renew them.
Could you have done it? I mean, I just don't know the data. Even I listened to the press conference. It's hard to figure out, what was the threshold? So Canadians go, well, why didn't we do this in June for the summer? There were tourist businesses like, please get rid of the ArriveCan. Please get rid of these mandates. It's killing us. What was the data point? And what is the economic costs of keeping them? Why is October 1st better than August 1st or July 1st?
Well, the economic cost of COVID has been very, very difficult around the world. Canada wasn't immune from that. The cost of not fighting the virus with every possible tool would have also been enormous.
But that's not my question. No, I get that. But,
but to say, Evan, we should have removed the masks earlier because of an economic cost, having those mandates and getting people vaccinated in the highest possible level, we think was a very good economic and obviously public health policy.
I understand that, but it's still material to do it either October 1st or let's say July 1st, right? I'm just trying to figure out what the data points are. Canadians say, you know what, this makes sense, the time is right today, and some others are saying, and the opposition is saying, this is political science, it's not medical science, there was no number, you could have done it earlier. There are doctors that say, you're making a mistake to do it now. There's some are saying you should have done it earlier, though. So what's the data so we can have evidence here?
Well, and you referred to some others who didn't think that Canada, the Conservatives, didn't think Canada would have vaccines until 2030. Some Conservatives still oppose vaccination. So at the end of the day, Evan, that's political posturing designed to divide people and scare people. We've said that we would listen to the advice of doctors and experts. And obviously my colleague Jean-Yves Duclos and other ministers talked to Dr. Tam, talked to the National Advisory Council on Immunization. And we thought that the rollover of the orders in council, the renewal of the orders in council this coming weekend would have been a mistake.
Okay, I get that. But I know I'm pressing on this because, Canadians have been through an extraordinary time. And again, I think it's really important because there's a lot of distrust. We should acknowledge it, that what is the moment to be transparent? The orders in council is not a medical date, it's a political date. So from a medical reason, at what moment did the scientists that you're listening to say the transmission is no longer an issue? And by the way, we could even remove masks on airplanes and trains, even though there is some transition. Is that could you have done it, for example, on July 1st? Would the data have changed dramatically? And if so, why can't we see that?
Well, we didn't think it would have been prudent to do it on July 1st. We think the prudent time to do it is on October 1st.
I know, but why? What's the date? Is there a dot that says this was the transmission in July and this is the transmission in August, And this is the transmission on October 1st, so this is the level we needed to get
And
to.
we don't know what the transmission, of course, will be on October 1st either. But Dr. New said today that with the community transmission,
Right.
with the presence of COVID in every Canadian community,
Right.
and the number of cases that are transmitted in a non-border, non-travel context, it wouldn't have made sense to continue the mandates, for example, on planes or the Arrive Can app or other things
I'm just trying. There's
after
a
October 1st.
Okay, but there's a mix. Is it a mixed message? Because there's like, well, we really think you should still wear it if you can. It's not a mandate, but we'd like you to do it. So, like, why not keep it if it's important?
Well, Evan, I mean, look at how agitated you are that we got rid of it. So what I'm saying...
I'm agitated, but I'm not agitated about the mandate. I'm agitated about data.
What I'm saying is exactly what Mr. Duclos said. We listened to the advice of doctors and scientists, and we thought that now was the appropriate moment to remove the coercive element, the mandatory aspect of these vaccine mandates or for wearing a mask on an airplane. But you know what? If you're sitting next to somebody you don't know in a confined space with poor ventilation, it actually is better if you wear a mask. The doctors said that today. So we're not going to say that it's not prudent or advisable to be up to date in your vaccines. That's the biggest single thing Canadians can do to protect our healthcare system. And wearing a mask on an airplane is not a very invasive thing to ask people to consider doing.
It's voluntary. I think maybe a lot of people might
I hope
still
so,
do it.
sure.
U.S. Congressman Brian Higgins, who's been on the show a lot, and he's a longtime proponent of lifting the mandates, lifting Arrive Can because of the economic cost of it. This is not coordinated with the U.S. Like, they don't have it. Why not?
Well, obviously there are ongoing conversations between our government
are they
and the
going to lift
American
stuff too?
Well, I can't speak for what the American government will decide to do based on the advice they have. We're following the advice of Canadian experts. The World Health Organization, as you know, said that the end of COVID may very well be in sight. So different groups of experts are offering different advice. We've made decisions always in what we thought was the best interest to protect the health and safety of Canadians, and the American government will do the same thing. But I represent a province, Evan, with a number of border communities with the state of Maine, and you're absolutely right. This has been very difficult. There's a golf club in New Brunswick that the clubhouse is in the United States, but the course is in Canada. So you can imagine this summer how difficult it was, and a number of people talked to me about that circumstance. So we recognize that, particularly for border communities, this has been very tough.
You could shank the ball and be an international traveler.
Or just or avoid the clubhouse.
Right. Okay, so just before I let you go, is there any possibility if things change that your government would bring back mandates or mask mandates? Possible?
You heard the health minister today. We certainly don't hope that's the case, but it would again be irresponsible to say there is no circumstance that we can imagine where there's a different variant of concern or some other public health emergency. We don't believe there's no plan to bring them back. We hope we don't have to bring them back. But no responsible government, Evan, would say there's no scenario imaginable where there couldn't be a circumstance. We certainly hope that's not the case, and we understand Canadians' frustrations with this.
Some provinces have said they'd never do it, but okay.